Today we're going to demonstrate our technique for a horizontal discoid meniscus repair. In some cases, after you clean up some of the discoid meniscus, there will be a horizontal tear such as this. The quality was excellent, and the decision was made to perform a hay bale technique, which we'll show today. So we've already done the removal of the torn up center discoid meniscus, and then we're going to use a torpedo shaver here to clean the edges. Again, you want to go to about 6 to 8 millimeter rim. You can see this variant did not have instability of the meniscus, so the capsular repair was not necessary, and the root was intact. We're going to do a trephination to bring egression of blood flow into this area. This can be a challenging area to repair. Again, this is a lateral meniscus, so care is not to go too deep posterior in the knee. Then we're going to use a ball rasp to irritate the center of the tear. And you can see the excellent cartilage in this patient, as well as the good quality of the actual meniscus, just that it's horizontally torn. We're going to place a cannula in here to prevent any catching, and then we're going to use a device to pass around the meniscus and compress it down. Again, this is using a O suture. And then the trick here, which is different than when you do a standard repair, is you have to do sequential knot tying. So when you have these knots, the key here is to try to get them on the inferior surface and try to get them out of the way of the joint space. Occasionally, and you'll see in one of these, is that we did get one above, and it's challenging to switch it. So you want to make sure that you have your post underneath the meniscus, and then when you cut it, you can actually shift the knot. We're going to come from different angles, so we started off coming from the lateral portal. Now we're going to come from the medial portal as we work our way around. And you see I'm trying to keep the knot on the inferior surface. You want to leave about 3 to 4 millimeters of space between these, and then we're going to continue to do sequential knot tying, and then we'll finally cut this. And you can see we've had a nice compression of the meniscus. The challenge is basically at the anterior mid-body to the anterior portion. Thankfully here, the meniscus anteriorly did not have the horizontal tear, but we did have to do a few inside-out stitches, as it's difficult to access this otherwise. And this is fine in this situation. You can see you get good compression from these, and these needles are so small and thin that you can easily compress the meniscus and pull it back to the capsule. So you can see we've done 3, and we place these, and then we'll make a small incision on the outside of the knee and tie them off. And then you can see we've gotten the entire horizontal tear. We've completely closed it down here, and patient will now be non-weight bearing with a rehab protocol. And hopefully this patient has excellent healing. Thank you.